Hello and welcome to this special edition of Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I've got Melissa Creighton with me from Family Health, and we're talking about National Health Center Week. Melissa, why should I care about National Health Center Week?
I'm so glad you asked, James. National Health Center Week is an annual awareness campaign that has been going on for decades. It is to raise awareness about the good works of health centers throughout the nation.
And that would be us. We're a
And
health
that would be us.
Yes. I know that we're doing some different things this week each day. Do you remember what those different things are we're doing each day this week?
Sure. So National Health Center Week has what we call focus days. And the focus day for Monday was to focus on our vulnerable homeless population. For Tuesday, we have our agricultural workers. So we have an outreach that was scheduled for our Sims Health Center site. And then Wednesday is our Patient Appreciation Day. And then Thursday is our Stakeholder Appreciation Day, where we sent thank you notes to all of our governing board and to also some other community leaders in health. And then Friday is our Staff Appreciation Day. So we have a special token of appreciation that goes along with the theme this year, going to all of our staff here at the Mobile County Health Department.
I can't wait till Friday. Everybody likes good free stuff.
That's right.
So what is this year's theme?
I'm glad you asked that as well. So the theme for this year is actually community health centers lighting the way for healthier communities today and in the future.
What is something that you think that people should know about community health centers? I mean, they know, before you answer, they know now that the Mobile County Health Department is a community health center. And we have multiple locations throughout the county, north part of the county, south part of the county, east part of the county, west part of the county. But what's something important that people need to know about community health centers?
Community health centers are the cornerstones for community. We assess our patients to help with chronic conditions. And as we all know, chronic conditions are terrible for the financial aspect for the community. If we can address things such as diabetes, high blood pressure in the early stages in our beloved patients, then that won't be such a burden later on in life for them. So better patient care, obviously, but also just from a broader perspective of taking care of people and it being less of a burden financially on the community itself, as well as the administration and just the community at large.
I know for us here at the health department, from working on these different initiatives, that there's a lot of things that we take the lead on. We inform the community about how good it is to take a walk on a nice day, and all of those things lead to better health and better health outcomes. So I guess, would you think it's safe to say that us and other community health centers we're the forefront of delivering that message out there?
Yes, I would totally agree with that, and go one step further to say that we are the leaders within the community on advising things such as, going from sewage spills to things about COVID and this pandemic right now, to chronic conditions such as diabetes and high blood pressure, and just better physical and emotional care. We've really stressed about the behavioral health aspects and the stress and the anxiety that goes along with this pandemic. So we run the gambit on just a wide range of services, a wide range of information. And I think the community trusts us to be that leader and trusts us to give them the information in a digestible way that they're able to take that and to lead better lives and to seek care when they need it. So I think that they appreciate us being here.
I agree with you. Let me look here. I've got some notes I had written, some things I wanted to ask you. Um, okay. Mhm. Okay. I know that you have a prop there with you. Can you? I have got a big note here that says Melissa has a candle with her. So can you explain a little bit about that?
I do. With the lighting the way in the community now and in the future for the community health centers, we wanted to celebrate and honor those on the front lines that have worked, especially during this COVID pandemic. And also memorial and in solidarity, we stand with those who have lost their lives to this pandemic. Our beloved patients, our staff, our community health leaders. Many people have suffered because of COVID. And this theme of lighting the way in the community couldn't come at a more profound time, because COVID has turned our worlds and lives upside down. And it's time that we take a moment and take stock of things that we've lost, people we've lost, but look forward to the future, look forward to building and rejuvenating our faith in each other and ourselves, and just look forward to what the community health center can provide to the community and the ways that we can support everybody.
That's very well put. I think maybe let's maybe just pause for just a brief moment right here, and for everyone to kind of reflect on that. I know that's kind of a heavy hitting part of what we were discussing, but if we can just observe just a moment of silence for that, and that candle, if you can hold that candle back up again, let's just kind of focus on that, and just kind of everyone reflect on the significance of everything that's going on right now. So let's just pause for a moment. All right, thank you. Um, well, we just kind of gave a brief overview here of, community health centers, and they obviously do play a vital role in this community in Mobile County. And we know that they do play that same role in other communities throughout the state of Alabama. I'm very glad that you brought that candle in, because, we do need to be mindful of, the way that community health centers do light the way during this time. Um, you touched on loss. There has been a lot of loss. There's been a lot of healthcare workers that have lost their lives. There have been families of employees, not just for us at a county health department, but also at private healthcare providers and at hospitals, other community health centers throughout the country. So, hopefully we've given, just a nice brief overview on kind of what we do and what community health centers do. And we use this week to kind of acknowledge all of the things that we do that maybe people just didn't know that we did. So thank you for mentioning that. I mean, like you mentioned, sewer overflows and everything else. I mean, we're kind of involved in everything. The health department has chickens, for surveillance for mosquitoes. So, I mean, yeah, we're heavily involved with pretty much every health aspect of our community. Anything else you'd like to add about Community Health Center Week?
Just for the community, if you haven't been to the health department, give us an opportunity to make you happy. Come in and we can provide, like I said, just a various benefits and various opportunities for services. If you have a question, feel free to call our central appointment line. If you have a concern about something out in the community, and that goes back to, the sewage spills or, any kind of food type of issue that you see going on, just give us an opportunity to help you. Give us an opportunity to make you happy. With school starting back up, I know we have a lot of children out there who may have missed their vaccine. And for those children that are doing virtual, it's still important. Please come in. Please get your vaccinations, because your children, you don't want to be exposed to some of these viruses and diseases that can be eliminated with a vaccine. So COVID is not the only bad thing out there. So I definitely want to stress that. But we're here to help, and we're in the community. So come find us.
Well, thank you. Thank you for mentioning all those things, and also thank you for being a champion for us here at the health department, bringing a lot of these things to virtual light and actual light. So I've been James Currie all my life, and you've been Melissa Creighton. And thank you very much for taking the time today on Wellness Wednesday to speak to us about National Health Center Week.
Thank you, James.